Hey guys, how are you all doing? If it's your first time here on my channel or your first time seeing my face, it's good to have you. My name is Blessing Njoh, also known as Mrs. Ejim, and in today's video, well, you already know what I'm going to be talking about in today's video, but before we get into it, I want to quickly thank each and every one of you who reached out to us after my last video. Thank you so much for all of your prayers. Thank you for your comments, your texts, your calls. Thank you so much. God richly bless you for just caring and showing us that you really care and you love us. Thank you so much. I appreciate it. Unfortunately, the test results wasn't good. No, it wasn't. So we are currently going through it, and we still ask for your prayers. And yeah, so let's get into today's video. There is no doubt everyone around the world is already sick and tired of hearing the word corona. Like, I am tired of it. Just say "co" beside me and I've already taken to my heels. Like, people around the world have grown wary of the lockdowns, the restrictions, the physical distancing, and of course the polarizing issue of whether or not face masks actually help reduce the transmission of the virus. So the big question on everyone's mind is, when is all of this coming to an end? And the simple answer to that is that scientists have not and will not be able to give an end date to the virus. Although the World Health Organization has categorically stated that the only way to bring an end to the pandemic is through a vaccine. And as we speak, over 130 potential vaccines are currently in development. And coincidentally, just today, Russia approved the first COVID-19 vaccine in the entire world. And there are speculations that mass vaccinations would stop the spread of the infection and bring society back to normal. But there are large groups of people who do not ascribe to that school of thought. But the truth of the matter is that the advent of vaccination is one of the major advances in healthcare. It has helped stop the spread of many diseases. Take smallpox, for example. Smallpox is a deadly, disfiguring disease, and it's been 40 years since smallpox was eradicated from the world after the introduction of the vaccine. But on the flip side of the coin, there are also other illnesses that have not been eliminated despite there being vaccines for them. For example, malaria, measles, chickenpox. A lot of people in third world countries still suffer from these diseases. But to be fair, the number of cases has exponentially decreased ever since the vaccines for these diseases were developed. So back to the question of when the coronavirus will come to an end. When people ask when, they are not really asking about when the disease itself or when the pandemic will die out. They are rather asking about the social ending. Like, when is the fear for the virus going to wane? So the expectation is that it will never really come to an end, that it's just going to be another endemic virus in our communities, something we just come to, start to accept, something we get to live with and adapt to, just like HIV/AIDS. The point is that we were all unprepared for this pandemic, and it is now our duty to collectively control the further spread and continue to think of new ways to be vigilant and more prepared for future outbreaks. Hopefully, we don't have anything as terrible as corona ever again. Not in our generation, not in generations to come. So I hope you found this video insightful. If you did, please go ahead and share it to someone who might also find it helpful. If you're not subscribed to my channel, you go ahead and hit that subscribe button and also give this video a thumbs up. Until I catch you again on my next one.